By focusing on advocacy, investment in health workforce development, health workforce measurement metrics tailored to the African context, application of gender lens to the health workforce development agenda, and resource mobilization, we are building on foundations laid at the February 2022 35th ordinary session of the Assembly of the African Union Heads of State and Government. It would be recalled that then His Excellency President Cyril Ramaphosa, the AU COVID-19 champion, articulated the recommendations needed to ensure a resilient recovery of Africa's health system and highlighted the need for a critical mandate for Africa CDC to champion health workforce development on the continent. The issue we've been discussing this afternoon is very urgent. Reaching the targets set by the African Union and UN agencies to accelerate health workforce development globally and in Africa specifically will not be easy. I'm convinced that with collaboration, coordination, and true partnerships, all will be possible. If I could reiterate some of the key points that we have discussed or transpired in today's discussions, without taking the risk of repeating from the key outcome of this event that the Honorable Minister just shared with us. Allow me to just, by way of emphasis, state the following. We heard that there is need to mobilize all the sectors, such as health, culinary, labor, education, and finance, to stimulate health workers, training, deployment, and retention. We also heard that there is need to ensure all workforce are adequately remunerated, particularly community health workers and female workforce. Also heard that there is a need to develop leadership programs for the female workforce. We also heard strong messages about the need to mobilize resources for investment in and also promotion of women's optimal participation in the healthcare sector and in leadership roles. There is a need to accelerate domestic financing for a fit-for-purpose health workforce to ensure sustainable and sustainability and return on investment. Another key message that was put across is to provide an enabling ecosystem for collaboration with the private sector to leverage their technical and financial resources and to ensure regulation and oversight. Last but not least, we heard about the need to design and develop and facilitate adoption of comprehensive metrics to evaluate progress and impact of the investments in the workforce. With this in mind, the African Union Commission is committed to working with all of us and support our member states to achieve these outcomes. We have the Africa CDC as the arm of the union to spearhead a lot of work that is lying ahead of us in this regard. Our commitment of the member states transpired a great. We congratulate them for the effort. And we wish to thank them for their leadership. And furthermore, we appreciate the commitment expressed here by our several partners, traditional partners and new ones, who are ready to continue support our member states to achieve this goal. Sincere appreciation goes to our distinguished speakers, esteemed participants, the MasterCard Foundation, and the African Union staff for making this event successful. To conclude, the test of a meeting like this one is not the production of a plan or a report. The test is whether better understanding of the issues and each other's position can be translated into positive action within our own areas of influence. Thank you for your participation and for the opportunity to close this very successful. Thank you so much.
I didn't want to speak after the closure, but please, our gratitude, and as we break and move on to our next agenda, really, it's action, action, action after all the discussion. So have a very good evening and safe travel to your hotels, and those who are going out of town, a safe travel back home. Thank you.